Aloha and welcome. I'm Dawn Pasikala, registered nurse with the National Kidney Foundation of Hawaii, and we welcome you to today's segment. We're going to talk a little bit about high blood pressure. I'm sure you folks have heard it before. What does it mean? What do I do? What number should I be at? Those are some of the questions that you probably have asked yourself or are asking yourself right now. What is high blood pressure? Well, high blood pressure is the amount of blood that is forced through our blood vessels from the heart. And that measurement can tell us a lot of different things. There are two numbers for blood pressure. The top number is called the systolic number, and the bottom number is called the diastolic number. And so the top number actually measures when your heart first pumps out the blood, and then the bottom number actually measures the resting period between the beats. And so ultimately we get that top and bottom number of your blood pressure. What is a normal blood pressure? What should I be looking for? Well, normal blood pressure is 120/80. So if you're around that, preferably a little lower than that too, then you shouldn't have anything to worry about. But again, you want to follow up with your provider. What's a high blood pressure? 140/90 is considered high. So if you're down in the 120s or anywhere in between the 120s and the 140s, you really want to be careful. And again, consult with your provider. Also, you want to make note with high blood pressure, the harder your heart works, the harder your kidneys have to work. So you want to keep that in mind. Blood pressure can affect a lot of different things. It can be caused by a lot of different things as well. And so you want to be really mindful of what you're eating, how you're exercising, when you're exercising. Are you taking your medications regularly or only when you're eating those high salty foods, which does not make any sense at all? If you've been prescribed medication for high blood pressure, take them as prescribed. Don't deviate from that. Also, you want to make note that high blood pressure is actually the second leading cause of chronic kidney disease, and that's why we chose to focus on this topic. It's really, really important, especially if you have let your high blood pressure go on for a long period of time, and we're talking months, possibly years, and you may not even know that you have high blood pressure, because actually it's dubbed the silent killer. Because there are really most times no symptoms of high blood pressure. So again, that's when you need to really self-monitor yourself at home, maybe have a blood pressure cuff machine at home. You can buy one really cheaply at Long's Drugstore, a CVS, a Walgreens, and also doing your regular follow-up appointments with your provider, okay? It doesn't mean if you take your blood pressure one time and it's over 120/80 that you have high blood pressure. You want to be able to monitor that and again, consult with your provider at the same time, because it takes a little bit of time to determine whether you've been diagnosed with high blood pressure and be prescribed some sort of medication for it. So don't freak out if you take your blood pressure for the first time and it's a high one. Just monitor it and report it to your provider. High blood pressure, being that it's the second leading cause of kidney disease, can not only cause kidney disease, but kidney disease can also cause high blood pressure. So it's kind of a two-way street here. You want to be really vigilant about, again, taking your medication, taking your blood pressure at home, especially if you've been diagnosed, getting enough exercise. You want to do all of those preventative measures to help treat or even prevent further escalation of the blood pressure. The best time to exercise is probably 1 to 2 hours after a meal. That'll definitely help bring your blood pressure down, also your blood sugar as well. Taking prescribed medication as the doctor has prescribed them. Don't deviate from that. Eating a healthy, balanced meal. Again, eating a variety of things, preferably things with lower salt or no salt added. There's lots of different things that you can use to flavor food. So ask your dietitian or your provider for some suggestions, and read the labels on your food products as well. That's really, really helpful. Smoking, if you are smoking, I encourage you to quit, because that can increase your blood pressure. And also alcohol, if you can do without it, great. Otherwise, limit it as much as possible. But blood pressure is a really serious thing. It's kind of like a garden hose, actually. So all of us have a garden hose at home, right? What happens when we turn on that water? What happens to the hose, right? It gets all stiff because it's filled up with water. Same thing happens when we have high blood pressure. Imagine that hose as your blood vessel, and imagine the water as the blood constantly rushing through those vessels for a long period of time, and you not knowing that you have high blood pressure. Over time, that actually damages the walls of the vessels and eventually can lead to kidney disease as well. So, we encourage you to take these preventative tips to stay healthy, to maintain your blood pressure, to see your provider often, to take those medications as prescribed, and just be healthy.